Pediatric Voice Disorders by Arizona State University Speech and Hearing. What is a voice disorder? A voice disorder occurs when one or several of the following are abnormal for a child's age, gender, or cultural background: pitch, abnormally high or low voice; quality of voice, for example, hoarse, breathy, etc., or loudness, too soft or too loud voice. Voice disorders can be caused by several factors: organic factors, which are physiological in nature and are caused by changes in the voice mechanism itself; functional voice disorders, which are caused by inappropriate use of the vocal mechanism when the physical structure is normal; and psychogenic, caused by psychological stressors that can lead to changes in voice. How often are voice disorders seen in the pediatric population? The reported prevalence of voice disorders in the pediatric population ranges from 1.4% to 6%. For the pediatric population, voice disorders are more prevalent in males than in females. The most frequently diagnosed voice disorder in the pediatric population is vocal fold nodules, which are caused by excessive and inappropriate use of the vocal mechanism, such as overuse, misuse, and abuse of the voice. However, it should be noted that voice disorders in the pediatric population are largely unreported and, therefore, undiagnosed. Some red flags to look out for are listed below. It should be noted that these signs and symptoms can occur in isolation or in combination. More red flags that may indicate a pediatric voice disorder are included on the slide below. When left untreated, pediatric voice disorders can lead to negatively impacted school performance, lowered self-esteem, negatively impacted ability to communicate effectively with others, negative attention from others due to differences in voice, limited participation in social events, and emotional responses to the voice disorder, such as stress, anger, confusion, etc. If you suspect a pediatric voice disorder, or know a child who is presenting with signs and symptoms of a voice disorder, discuss your concerns with a trusted colleague, such as a fellow teacher or a speech-language pathologist. If your concerns are shared with colleagues who are also familiar with the child in question, discuss options with that child's parents. Recommend that they make an appointment with an ear, nose, and throat doctor, or an ENT. The ENT may suggest voice therapy with a speech-language pathologist, who can help the child and their family cope with this change and provide vocal exercises and therapies that can be done at home and while at school. It's important to remember to be culturally sensitive and know that voice practices and norms can vary between different cultures. For more information about pediatric voice disorders, check out the links on the slide below.